our first topic today is CPR, and knowing how to perform it could be the difference between life or death. Having the knowledge and skills at the right time is priceless.
That is why today, Bill Spurbeck and Sean Kimball are here to tell us how we can all learn CPR. Gentlemen, thank you so much for joining us.
Thanks for having us.
So, Bill, let's actually start out with why should we learn CPR?
Well, why we learn CPR is to truly save a life. It boils down to learning CPR, and over the years, it's become easier and easier and easier. And over the years, statistics have shown that the more people know it, the more lives that are saved. And as an example, I've been teaching CPR since the early 80s. 2 years ago on Mother's Day this year, my brother was in a restaurant locally here, went into cardiac arrest, and nobody did CPR. So it kind of our passion to get it out to not only people that need it, but to the community. And you hear stories frequently on Facebook and other social media about 7, 8-year-olds, 9-year-olds successfully doing it. So
that's right, we do. We hear stories every day. And wouldn't it be nice to be one of those people that actually knew CPR in case that was needed in a restaurant or anywhere? So tell us about CPR2U and what you guys do.
Okay. CPR2U is an American Heart Association training center. We're licensed to provide CPR and some other advanced courses and first aid to the community amongst industry, healthcare professionals, daycare centers, a multitude of different types of businesses.
Well, let's kind of dive into that a little bit more, Sean, and talk about what types of occupations actually require CPR.
Absolutely. Most people think that it's just medical training for just paramedics, nurses, and doctors. It's actually required in a lot of different industries. One of the things we were talking about before is in like the electrical industry. Most of the folks that deal with electricity, deal with natural gas, all of your folks that do massage therapy, things along those lines. We had a large local bank here that had 800 of their tellers go through the training as well. So your coaches, whether they're for football, baseball, track, whatever are required for that as well.
I think that's incredible. And Bill, I'm going to come back to you. I know we're talking about why it's so important out there, but really, what is the mission for CPR2U?
Our mission is simple. We save lives by training. At one time, it was 8 hours to take a CPR course. Now it's 2 hours. Wow. So again, focusing on the mission of saving lives, because it's just not the elderly that you might come across needing to do it on. Drownings, as an example, hear about them. We're going to our drowning season, and unfortunately, we still hear about those almost on a weekly basis in our community. And for years and years, we've been out there trying to train people and educate people about drowning prevention. It still happens, so you never know when it's going to occur.
Well, like we said, we don't want to have to use this, but when it is that time, we want to be able to have those skills to take out and to be able to use. So we're talking about the hours kind of reduced between 8 hours down to 2 hours, but how easy really is it to take a class and to learn this?
Oh, it's actually very easy. What you just do is you can go to the CPR2U website, CPR2U.com, and you basically look for a class that's going to fit your schedule. We have them multiple times during the week. We have them both during the day and the evenings and also on the weekends. You sign up, we get you set up for a course. It's real easy to sign up for us. Then you just show up. You come in comfortable clothing, and we sit there and we teach you the compressions and ventilations and how to utilize an AED.
Well, and I see you've brought two different, what do we call these, dummies or?
Mannequins.
That's what he calls
mannequins.
me.
Mannequins. Yeah. So are there different CPR classes that you are teaching?
Absolutely. We have two different types. We have one that's mainly specifically for healthcare providers such as paramedics, EMTs, nurses, doctors, folks that work in the medical field. And then we have what we call the Heart Saver class, and that class basically involves everybody else. Anybody that wants to take it, everything from a grandparent or a coworker or any other type of adult that's not specifically required to take it for a job-related medical field. But yeah, absolutely.
Well, let's kind of learn a little bit here today with the two mannequins that you have brought. Tell me what we would normally do in a class with this mannequin.
Absolutely. So this model here that we have in front of us is going to obviously simulate our adult patient that we have here. Basically, the American Heart Association has 3 different types. We have 2 today, just for clarification. So this would be our adult, this would be our infant, which is less than 1 year of age. This is the one that most people like to learn on, obviously, because it's for adult, and we think of the community as an older community. So basically what we have is a half mannequin here, and what we're looking for is a couple of landmarks. First of all, we want to make sure for anybody that takes class that we make sure the scene is safe, because we don't want to rush in and become a victim as well. Make sure that they're alert, make sure they're not sleeping before we do anything to them, and then we're going to place our hand on the lower half of their breastbone here, and we're going to press down 2 inches and let the chest fully recoil. What we're going to do is we're going to do 30 compressions to 2 ventilations, and depending on which CPR you take, you'll either do mouth to mouth or you'll have mouth to a barrier device, is what we're looking at doing. So 30 compressions to 2 ventilations, we do that for about 5 cycles, and then what we do is we stop and we check to see if they're alert. Hopefully by that time, if it's pre-hospital and you don't have 911 coming, you've already alerted somebody to come there. And so would you like to try that? Do compressions?
Yes.
Okay, so let's move over. So you're gonna place your hands right here, and you're gonna lock your fingers and pull up, and it's gonna be kind of hard to push down, but do the best you can to push down. There you go, good job. Good.
Now, I've heard you're supposed to sing like "Staying Alive."
You can, absolutely.
Is that the right?
You
tempo?
can do Staying Alive if you'd like,
Let's hear
absolutely.
Tina sing it.
Under the bus on that one.
Yeah, I'm
there
singing
you go.
alive and singing. I don't know if I could do both of those.
Tina, you just need to let her know she has to harmonize though. Okay.
I know, right?
And so the next thing that we would do is we would put our hand right here like a little karate chop to the forehead, and we do that to open up the airway so we could give them a breath. If you want to use a Berry device, you do that and you place your mouth over that. So there you go, and you would give 2 breaths. There you go. And then you would set the mask down here, and then you would go right back to compressions on that. Good.
So when we do it for the baby, it's altered, obviously, for...
Sure, absolutely. So real quickly go through this one. This mannequin here is for basically a child that has not reached their first birthday, 364 days or less. So for them, we would want to tap them on the bottom of the feet. We want to make sure the scene is safe. Tap them on the bottom of the feet and see if they're alert. If they're not, we're going to call for help. And what we want to do is we want to expose their chest a little bit. And what we would do is make an imaginary line across their nipples, and we take our 2 fingers, we place it straight up and down, and we'd actually do compressions. You can hear this one breathe.
Oh.
Okay. Yeah. So we would do that. And for this one here, if we're by ourselves, we'd do 30 of these to 2 breaths. Or if we had the 2 of you working on it, one would do compressions while the other do ventilations, and it would be a 15 to 2.
Brilliant. Well, I have a feeling we're just touching the tip of the iceberg here. So much more to learn. So I'm going to let our viewers know about a great deal that you have going. And I just want to thank you guys so much for coming, bringing the mannequins, and showing us some of what you do today.
Thank you for having. And lastly, is that anybody that attends our course, it is a certification course with the Heart Association, so you do get a card that allows you to be certified for 2 years.
Well, I'm going to give them all the information to get in touch with you. Now, CPR2U will give a 50% discount to students who mention promo code THEBLEND. For more details, call 400-8204 or log on to CPR2U.com.